Narrow networks are a real concern in the Affordable Care Act marketplaces, but much more for kids than many think. This is Healthcare Triage News. Narrow networks refer to the issue that some insurance plans, especially those offered on ACA exchanges, contain too few options for covered physicians and services. Negotiating contracts with specific providers and then steering beneficiaries to those providers is one of the ways private insurance companies can reduce spending. Unfortunately, the trade-offs are that this restricts choice and access in exchange for lower costs. While much of the publicity around this issue has focused on adults, many have argued that narrow networks are an even bigger problem for children. There are fewer pediatric subspecialists to begin with, of course, and policies often fail to consider many childhood services necessary when benefits are determined. A recent study published in Pediatrics focused on both adult and pediatric physician networks and ACA marketplace plans. The authors aggregated data on physician networks and specialties in all 2014 silver plans offered in the ACA marketplaces in 2014. This alone is an impressive achievement. There were 1,836 unique networks identified, and all physicians were standardized into 47 specialty groups for the purpose of this analysis. Narrow networks were defined as those that had 10% or fewer of the available providers in an area available to beneficiaries. Narrow networks accounted for about 2/3 of pediatric specialty networks and about 1/3 of adult specialty networks. So right off the bat, kids are at a disadvantage. The proportion of narrow networks was highest for pediatric infectious diseases, 77%, and nephrology, 74%. Even neonatology, or care for the very tiniest babies, was often narrow, 69%. Among adult physicians, the proportion of narrow networks was highest for psychiatry, 50%, and endocrinology, 41%. Almost 44% of pediatric networks had no specialists whatsoever available to beneficiaries. This was much higher than for adult beneficiaries, or only 10%. Narrow networks were more common for pediatric care in every single specialty. They were also more common in rural areas. In areas with a low population, many specialties saw narrow networks approaching 100%, and pretty much all of them saw proportions above 80%. It's bad enough when it's hard to find a specialist in network, but in large proportion of these narrow networks, there were simply no specialists to be found at all. Again, some of this is likely due to the fact that there are too few pediatric specialists. They also tend to live and work in more urban and higher population areas. But they also tend to work in academic medical centers, which are often more expensive and are therefore excluded from narrow network plans. Some have even posed the idea that this is a benefit to insurers. By excluding specialty care from its core offerings, narrow plans are more likely to attract healthier beneficiaries and less likely to attract chronically ill children, leading to lower overall spending. No matter what the reason, this is a real problem for pediatric care, especially the care of children with special healthcare needs. The majority of pediatric specialist networks lack specialists. This inevitably will lead to increased spending for children who need care, barriers to their obtaining it, and a reduction in the quality of the care they receive. There's no easy answer here either. It's unlikely we're going to see a real increase in the number of pediatric specialists or any reason that private insurance will seek to broaden its networks, especially as premiums are already too high for many Americans. As with many issues in healthcare, trade-offs are always involved. We can increase access, but likely only by spending a lot more money. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course our Surgeon Admiral Sam. Thanks Joe, Jonathan, and Sam. More information can be found at patreon.com/healthcaretriage.